Wonderful, thanks everyone. Hey, I want to welcome everyone to the Town Council Board of Finance, Health and Human Services Liaison Committee meetings. We're going to be going over the budget for Health Department and Human Services. So, Jen, do you want to start?
I think I
Yes.
may start.
Oh, you want to
don't
start?
mind, just
Okay.
because I'm waiting for Jen's to come in.
Oh, okay, sure.
She emailed it to me.
Okay, so I'm getting terrific.
All right, so everyone got a chance to look at the numbers. I can go over everything or I can answer questions, whichever you guys prefer.
Do you want to just kind of give us an overview of what's changed this year? I know that you're using a bunch of grants to
Yeah.
fund
So-
the nonprofits and maybe just if there's any other major changes in your budget.
That's about it. I made sure that none of the grants, none of the requests were made any smaller. Everyone who asked for what they needed, like from last year, are
Mhm.
receiving the same amounts.
Mhm.
They are just going to be given slightly different. We're using the YSB grant in a more efficient way and the opioid settlement money in a more efficient way.
Okay,
So-
great. Could you just explain to us what the YSB grant is?
That's the Youth Services Bureau grant that Jackie receives. And she was giving little bits and pieces to like the after prom party and the color drop and things like that. And this way, we've picked 3 organizations that we think are it will be more efficiently used.
Sorry, who grants the youth service grant, where does that come from?
That comes from the state.
From the state, okay. And you said that youth services grant and opioid settlement, what was it? You said
That was it.
Okay, great, just this.
So what's the opioid settlement grant is funding what portion of the nonprofit?
It will be funding 10,000 towards kids in crisis.
Okay.
It will be funding 8,000 to New Canaan Cares.
Mm-hmm.
And 25,000 to the assessment program at Silver Hill.
Okay, and I noticed the assessment program funding is going down a little bit. Could you maybe talk a little bit about that?
Absolutely, the request from Silver Hill has gone down. They are now capable of receiving some insurance payments, so
Okay.
that is fantastic. They are now able to bill certain insurance companies, so if people are willing to share their insurance information and Silver Hill works with that insurance provider, they will bill insurance.
Okay, but it's not a requirement that they do
It's
that.
currently not a requirement and, I don't know if that's a privacy thing for, that's something that Silver Hill needs to like decide on how they're going to be addressed.
Is there a reason people would not submit it to insurance?
Insurance, you have to, as a provider, you have to give the diagnosis, and there are some people who just don't want that diagnosis given to their insurance companies. So there are a lot of people who will use, out of network or private pay
Wow.
therapists because.
Or maybe their employer-based insurance, they don't want the
Right,
employer to get it.
I don't think
Mental
employers are
health
allowed to
issues.
do that, but there are the laws, but that is. You as a provider, you get a diagnosis code to your insurance company, it is what it is.
How do you estimate how much they're going to receive from the insurance?
I guess that's been over the year, that's a.
That's just an estimation, okay.
Okay, another thing I'd like just to ask about that I know was in the Board of Selectmen meeting, the general assistance number of
Yes.
15,000 that's not showing up on the budget before this fiscal year request.
Right.
Could you talk a little bit about
Sure,
that?
of course, so historically, the town gave 22,000 for us, and that went to like our help with like rent and energy and food and that kind of thing. We had sort of a stockpile of that money, so we've been spending it down in 2023. The town asked us to spend it down and stopped providing that money, so in 2023, we used 34,000. In 2024, we used 30,000. Year to date, it says here we've used 18, but just last week Jackie and I helped with rent with a couple more people, so I'm gonna say it's at about 20 now, so we are only down to 28,000, which it will be much lower by the end of the fiscal year. So we're asking for the 15,000 just to get us back to, because we tend to spend about 35,000.
Okay, and can you just, what, is it for assisting residents, or can you tell us a little bit?
They all go through a financial assessment.
Okay,
And once that financial assessment is done, we don't help to maintain residents to stay here.
Mhm.
If that would be nice to be able to do, but we
Right.
don't do that, but if there is like a month that, you know, they're out of work or they need help with rent or they need help with an electric bill, that's us, we will help them with that, once they've been vetted.
great. Okay, are there any other special project funds that the Human Services has access to besides this general assistance fund, which I guess is
No.
now being drawn down, so there's no other funding sources or? And what about grants besides the USB and the opioid settlement money? Is there any other grants that you have access to that you're aware of?
There is for the Get About,
Yeah.
but that is it, that's the Connecticut DOT grant.
Oh, right,
And that's, I think we applied every 5 years for it, so,
Okay.
you know, that's not, doesn't have to be, you can ask for it until 2008.
Okay, great. Any other staffing changes or any other major changes in the budget that you wanna just talk about?
Absolutely nothing, no, we kept a small part-time budget
Mhm.
line, just because we aren't, you know, I've only been at this for about 6 months and we don't know how much the demand will be, you know, like how quickly Avalon will be, you know, whatever it's called now, what is it called? I can't remember.
River or something.
River, yeah. We don't know what that's gonna look like, but yeah, you know, so we don't, and consistently, our numbers are going up every month, like I've been doing the year to date on this, I keep changing it, you know.
Mhm.
So, yeah, if we end up needing a part-time person just to help us with something like the state program.
Like administrative tasks,
Yeah.
is that what Enza does now?
Enza does that, but she also spreads herself with food pantry,
Right.
she helps with finance, she's sort of everywhere.
Okay. Anyone else have any questions about human services?
But what's that with the opioid settlement, it's not, how many more years do we have of that, or is that going away?
I don't know the specifics, like, is it 11 more years?
I believe it's
I-
10 more years.
10 more years, so we've got some time, and it's a different amount
That's a
every year.
different dollar amount,
it's
yeah.
a little bit, but we know what we have for.
Right. I was just curious how reliant we are on that to come in every year.
Currently, right now, we are using it.
Okay.
Do we know the aggregate amount that we were granted the opioid settlement money? How much, what the grand total is, how much we got?
I think it was like 300,000 or
It
something.
was a little over 300,
Yeah.
but it also keeps changing as other companies are, they're going after other companies, so it seems to keep going up.
Okay, and when does it expire? Did you say 10 years?
10 years.
So 2034,
Mhm.
2035? Okay.
I mean, I can ask Anne at the
She has a whole
finance.
account.
Yeah,
Exactly.
just curious.
For some reason, I think it's like currently 346 or something, but I don't.
Okay, great. And no other questions? No? All right, terrific. Well, it's great news that things are not being defunded.
No,
So thank you for all your work that you've done. I know you
Yes,
took
no.
over and I know it was a lot of stuff, so thank you so much
You
for
are welcome.
working on all that, and for helping us and. Okay,
If you'll just bear with me.
sure.
1 second. See if I can get. There it is. See it?
Attachment?
Yeah. Okay, this one? Or this one?
The Excel.
Okay, hold on, coming.
Okay, thank you.
I'm sorry, I'm new at this, and
Jen, can we work from the paper copies until we get the
Yeah.
IT version?
Was Todd on the email when I sent it to you guys?
I don't know. Todd, did you receive Jen's spreadsheet on the health budget, by any chance? Is a one pager? It would have been in your email.
It's not shared. Your numbers, okay.
You got it?
And then hit share.
Okay.
I think I have the details, yeah, there you go, you have it in the budget book.
Okay,
It's what's online, so.
Okay,
so
yeah,
none of
exactly.
that changed.
Yeah, okay.
okay, great, thank you.
So, overall, our budget has a slight decrease of 0.04%. That is mainly due to the part-time budget. So when Dr. Reed, as the medical director, retired, after he retired, we did a salary study of all the medical directors in Fairfield County region. And the new medical director is at that level that we found in the area, so that was a cost savings of around 20,000 then. And then another part of the part-time, we used to have a clerical position in the part-time, well, because during COVID and everything. But obviously with OpenGov, that's not necessary anymore. But we are essentially using that money to transfer the public health nurse whose grants, after 5 years of paying her on grants, expires June 30th. But we still will have a decrease of $18,000 in that budget. Because we're only putting her at 10.5 hours a week, which seems to work because we took the blood sugar and blood pressure clinics and combined it into one to health screening and the coffee talk and, vaccination appointments, but we can make that number work. Currently, she's being paid on the workforce development grant. Now, the other part of your guys' questions were about, what's going on at the federal level. Well, the workforce development grant, we received that 45,000 upfront. That's sitting in the town coffers as we speak in finance. So we don't need to worry about the fundings, disappearing. The only grant that we will still have and currently have is the public health preparedness grant. That's only the 11,300 whatever in change. So if that does end up getting taken away from the federal government, I just simply go back to doing that work as I did before we got that grant. That's, updating the preparedness plans, going to the meetings and all that jazz. I'm not gonna be asking the town to supplement that. I'll just go do the work. It's not an issue. I did it before, I could do it again.
When does that expire, Jen, that grant?
Right now, we're just started a new 5-year contract,
Oh,
but
okay,
with everything on pause, we don't know how that's gonna end up. It's not listed in the memo as one of the targets.
Yeah.
But, again, it's not much money, so it's not the end of the world if it does, go away.
okay.
And other than that, we did slight reduction in overtime, because again, with workload decrease in the efficiency of OpenGov and everything, it's helped narrow that, and we also lowered office supplies again too, for the same reason. So, and then revenue side, I sent to you all as well, we're proposing modest increases there, just based off the numbers that I've gotten from OpenGov. Doing the year from November to November since we went live. Last year, we were over by almost $20,000 on plan review, which is building permits. So I'm proposing to split that in half and say, 70,000, just because I don't have the full fiscal year in OpenGov yet of July 1 to June 30th. And I'd rather be a little, under and you bring in more money than not meet it, overpromise and not meet it. And then Restaurants, we propose a slight increase, and that's due to the fee changes that went into effect July 1. So it's an 8.37% proposed increase in on the revenue side. So,
Excellent. I mean, OpenGov seems like it's doing an amazing job. Thank you for bringing that to the town. I know you were behind that and it's just really streamlined everything so nicely.
yeah, we love it, and the contractors love it, because the permitting goes a lot faster. I mean, it used to be 6 to 8 weeks, now it's maybe a week.
Yeah.
So it's definitely streamlined everything.
Mhm.
Plus, you know, all the reports we can get out of it of even, you know, if like wetlands and P and Z pay state fees and state education fees. Because of the account numbers are in there, you can pull up the reports and see exactly how much money now that we've sent to the state and, you know, those kinds of, how many permits each department's doing, so you can see the real workload, not just, you know, projecting, it's actual numbers.
And you can see it in real time, right?
Yeah, we see all the permits come in on the main
Yeah.
screen in real time that all of us can click on, I mean, so there is nothing hidden.
And that's 24/7.
Yep, and contractors and a homeowner can go in and look up, because before they would be calling, where's my permit? I was told you have it, you're holding it up. No, it's not true, now they can see it, so it's been great for everybody.
Yeah.
Did you increase the price in the restaurant permits?
Yeah, there was a modest fee increase. Last year was the first time we increased fees in over 5 years.
Okay.
And that had to be run in the paper for 30 days, the board of selectmen had to approve it.
So it was the increase in permits driven by?
No, that was only for restaurants.
Right, for restaurant permits.
But for
permits.
building permits, that was just
Yeah.
solely OpenGov of getting the permits we
Right.
weren't getting before.
Okay,
We were being cut out of the process on some permits.
right,
Now they can't cut us out.
right. So restaurant permits, that pricing went up, but.
Just because of the fees.
Just because of the fees, right, just because of the fees.
Mhm.
There weren't more people.
No,
There was just.
because every time something closes, something else opens, I mean, it's kind of.
And it's temporary permits too, I heard you.
The temporary event permits,
It's in that number.
well, because there's a decrease on the temporary event permit side because of Waveney and the unknowns. You know, people are more hesitant to booking weddings and other things.
Yeah.
Which we get temporary event permit fees on,
Right.
so that increasing here offset it
Yeah.
essentially.
Right. Great. Thank you. Anyone have any questions?
Yeah, I do have a question. You mentioned, limited staffing, is really a problem for you because of delay in getting inspections done and so forth. Did you request, another part-time person? And
No.
it's not-
We don't have any issue with getting our work done.
Well, you put it in your report here.
No, I
It
didn't.
said, limited staffing presents a challenge to keep up to date with the required number of inspections.
I don't know what report you're looking.
In our budget book,
That's both of the narratives from years ago, that was before, it just hasn't been updated.
well, that's why.
That's right.
If it's not updated, then I gotta ask a question here.
Thanks for looking at the
Because I see a
details.
little problem if you've asked for staffing and not getting it, I'd like to know.
No,
why.
we got that person years ago with Shannon,
We're gonna
Yeah,
have to
so
update.
that's old.
yeah.
Yeah, but it's good, you know, we probably need to update the narrative, right, for at least your department, so that's not an issue anymore. Got it. Any other questions?
And Marcy, you're okay with yours, you're down a person?
Yep, we are down a person, but it seems to be working.
Well, because I'd be a little concerned about not being able to service our people.
Right.
You know, if you look at the library at a almost 8% increase, I would think that our funds should be directed at our people and their health and so forth.
Marcy did leave a part-time
I did leave a
position
line,
in, so we can always fill if she sees she needs that, so we do.
but I am
Okay.
still doing my programs at Labum, I am still doing my grief group through hospice at Waveney, I'm still doing home visits with protective services, like I am still totally able to do what I was doing and get.
A little different. Carol was more of an in-house director where Marcy is more on the outside. So Marcy's getting involved in groups and still running the groups. And so a lot is being done at a director level, which we didn't have before.
Okay, but
You mean Bethany or?
Carol, both Bethany.
Carol was before that.
Oh, Carol was before that, yeah, so both of them.
So you have a part-time person on the books in case you need it.
Absolutely, yeah, okay.
Any other questions? I have one question, and this is not on, so thank you for your budgets, thank you, it's very, efficient, and I really appreciate all your work. One question about prevention council, and I know Marcy, I think when I looked at your presentation, it fell under, I think it was outreach. Is there any thought to giving Narcan training to residents of Buchanan, as like a public meeting,
That
kind of like what Jen does for the suicide
That
prevention?
actually has been done, Colleen, yeah, she did it at Milford, she's done it at Cambridge College, that is being.
Right. Could it be rolled out for like at the library or
Oh, I'm
program for
sure,
residents?
yeah, absolutely.
Well, last year's opioid funds, Russ Kimes had bought a bunch of Narcan kits that he gave to New Canaan Cares, and they did do a lot of that. They even did it for the restaurants and stuff.
Yeah, I know it's only been done for private groups, it hasn't been offered as a public program, and I was just wondering if that's something we could offer at large. There have been some unfortunate, deaths of people in the community from, overdoses and things like that, so just curious to know if we could maybe roll it out on a larger scale.
Oh, 100%, I can ask her, I'm sure she would love to do that.
Yeah, okay, cool.
Do you feel like the public is getting what as to what the services you provide? Because I think that was part of the behavioral health survey.
Yeah.
Of how maybe there's a people.
I do. Do you guys sit in on our human services?
I sit in on the
I sit on the
meetings.
New Canaan Cares.
Do you ever listen, like, so,
Yeah,
The
we were all,
30%,
we were all, many of us were at the behavioral health.
oh, good,
yeah,
okay.
reveal.
So I do feel like 70% A is really good.
Yeah.
Of the people who do know, and then the 30%, we really have to sort of figure out what that 30% really looks like. Is it 30% who don't know because they don't need it and don't want it? Or is it 30% who, are they English speaking? Are they, some of them don't wanna know because they only want private pay, they don't wanna know about 211. So, we're gonna have to ask them to sort of break that number down to what that
Right, so-
really is. Cause is it 30% that should know about it and don't know about it, or is it 30% who don't know about it because they don't need to or want to?
Right, so
that-
what we're talking about is behavioral health survey results, is that the 30% of the population was not aware of how to access assistance, not just mental health assistance, but other kinds of assistance, so they're gonna look into that number is what you're saying.
But they also said that the people who don't know about it are probably the ones most in need of it. So that's,
But that might be
These are-
self-fulfilling,
Yeah.
I mean, in my observation, again, like sitting in, I know this is not the New Canaan Cares Coalition, like there's so much cross-pollination of messaging, like there's so many different outlets, I feel like, Tom's doing quite a good job of getting messages out. That's
We have to
better,
applaud
we still got it, right?
That is awesome.
Well, if you ever need me to send anything out to my health group in Everbridge, cause Deanna's, pushed the whole communicate thing, and I think it's been great.
Yeah.
Because, the feedback from the residents, I had 1,900 people signed up for the health group, who would have
Yeah.
thought? And it's definitely helped us with our numbers of people showing up to all our community health stuff. And people that didn't know you offered this, and now all of a sudden they do, but they gotta, again, check off the buckets too, they gotta want to know,
Right.
not to get the information.
I signed up for that. Marcy, does that newsletter have a human services component that could go into the First Selectmen's Everbridge system, or is it just Jackie's?
Just Jackie's,
newsletter?
and then as things come up, like we have a donation button that we're working on, I've been talking about it for
Yeah,
months.
yeah.
I have been given a date, I think it's gonna be in March, I will make sure that that gets out and into the newsletter, and that would be great, because there will be a pull down menu.
Yeah.
And people will be able to choose to donate to domestic violence, or to the warm up fund, or to most needed, so we're really looking.
Is food pantry part of that
these-
one? Is food pantry gonna be part of that?
Food pantry, will absolutely be part of that.
It would be interesting to add that to the Everbridge system, because you might get more of an outreach,
Oh,
because
absolutely.
that's just the thought, you know. So any other comments on that? So.
I have one question for Jen, if I could.
Yeah,
First, a comment. Jen, as always, great job. I appreciate all that you're doing for this budget. My question is just on the current year, are you running a little hotter than 50% through December? Are you good on your current year budget? And it could be that you've got some one-off things that are just, I mean, your salaries are right on 50%, but everything else was, maybe a couple of things were a little higher.
Oh, yeah, cause we make sure to watch it and not go over anything, especially with, overtime and stuff, but like supplies, like medical supplies,
Yeah,
you buy all in one bulk.
Yep.
So that you get whacked with a high number up front and then you don't.
that's okay. That's what I figured. I just wanted to check. Okay. No, great job.
anything else, Todd?
Nope.
I think might be my last question. Are there any things for us to look forward to, in initiatives or any programmatic things that either of you are gonna be implementing just as kind of like something for us to look forward to, or any changes in what you're doing already?
Well, we're gonna continue with, the programs that we have. Obviously, we always do add different topics, like we're looking to do another mental health forum like we did last May for mental health awareness. And we're in the planning stages of that, and continue to do, skin cancer, the blood pressure clinics, the blood sugar clinics and all that stuff. But if you ever have any suggestions, reach out to us. It doesn't cost much money. We like to do things that, you can come to our walking club, that we're starting.
Walking club,
That's free.
Yeah.
It doesn't cost any
Definitely
money.
money.
Yeah.
And I am going to be partnering with Catholic Charities and Laurel House to do some open office hours within our department, so, because a lot of residents have a hard time getting to Stanford, so Catholic Charities does like a family loan program, and they also do a budgeting program. So they're gonna be coming the second Monday of the month from like 10 to 12,
Right.
starting in March, and then Laurel House will be helping. It's the things that we aren't able to help with, so Laurel House will be helping with like
Right.
and so hopefully that'll be
Yeah.
So is that straightforward, like budgeting program, like helping people with personal finance?
Yes,
Yeah.
yes.
And Marcy, can you tell everyone what happened on Saturday? With
What
your
did happen?
certification, your license?
Oh, yes, I got 25 years late, but I finally got my LCSW, so. I was in LMSW with mine. Terrific. I retaught myself graduate school and like.
Yeah, that's a lot.
I'm curious about the people who need rental assistance, does that come from them directly, or is it someone who refers them to you?
It tends to come from like word of mouth, or Chandrita or Amy. They will see it starting to happen, like if they've missed a month and they really do try to prevent evictions and stuff,
Right.
so they will send us these people.
Because it'd be really hard for someone to reach out and
Right,
say, I
it
need
is,
help, so it's
But
good.
we are so approachable and easy. Like,
Yeah.
it's like not a big deal. Yeah, so we do a quick financial assessment, we don't make them feel bad about themselves, so yeah.
Along the lines of the kind of question you just asked, that navigator system that they do through Wavy, you guys, that's completely independent from them.
I think there's a cost to that.
There is.
I think there is. Is there a cost to the navigator?
I thought it was free.
I'll finish it.
I
don't know, don't quote me.
Don't quote me either, I'm sorry.
I'll look that up.
You're being recorded.
But exactly, so the town has no contribution. That's
Yeah.
independent.
Oh, the navigator, no, you're right,
That's
actually,
all
all
the
the
cares
cares
for
free.
free.
The navigator
Helping with
is free,
Alzheimer's.
it's that telehealth that is a cost that people who participate on an iPad waiving, that is different.
So the navigator is supposed to like, if if you're a caregiver,
Right.
to tell you what resources.
Right.
you have.
And as long as like, it can be either the person who needs the help lives in town or the child of the person.
Yes.
But that's through waiving, is
That
that
is
correct? That's not a town service.
That was sort of my question, so
Okay,
I
that's
don't
what
hear
you're
the answer, so I will
Okay.
look for that.
And I would imagine some of the youth services comes from the referrals come from the school, I would imagine.
Yeah.
Okay. And that's the.
They are in contact.
Does anyone have any other questions?
We're good.
Okay, terrific. Well, thank you for coming and presenting your
Thank you,
budget.
guys.
Thanks for everyone for coming. Can I get a motion to adjourn? Can I have a second? Thank you, Jen. All right, a motion to adjourn, meeting adjourned. Thank you, Todd, for coming.
Thank you all. Yep, great.